ready?
Yep.
Okay, so knock knock. Hi, my name's Crystal. I'm going to be your nurse today. I'm going to perform hand hygiene. We're going to be doing a central venous dressing change and flush. Can you state your name and date of birth, please? Patient would insert their name and date of birth. I'm closing that for privacy. I'm going to come over here to the computer and double check the order for the dressing change and flush. Make sure that we have the right person. I would check their armband, double check, and then I would go get all of my stuff, which is all over here. So hand hygiene, I would put the gloves on. I would also bring a wastebasket over here. And then I would do hand hygiene again and then put my gloves on. Okay. Then I'm going to come over here and remove the dressing, but before that I would have put the mask on the patient and had them turn away. And I'm going to be holding the catheter down so as I'm removing, I don't pull it out. I would probably be doing this a little more gentle on a patient. I really want it off. Oh my gosh. So this is going to be a little more gentle on a patient. This is kind of difficult though. Okay, I'm going to throw this away and I am going to inspect for signs of redness, infiltration, pain, discomfort when I palpate. None is noted, so at this time I'm going to take my gloves off and I'm going to set up my sterile field, performing hand hygiene once again.
Hello. Hi. Change out. I'm your nurse today, and I will start off by changing the central line dressing because I believe it's about time to change. Usually for protocol, usually doing central line dressing. So, before we enter the room, I grab all my supplies, so I have my central line dressing. So we're gonna do that. Protocol, so you can have my patch. And just because
I just thought my sterile gloves were in here. Pretending like I didn't touch that. So I probably would have done this over here, and we're gonna pretend like I'm all sterile once again with everything over here that I need with the chlorhexidine wipe. Oh, well, I didn't realize that was in there. So that would have been on the patient. And then with the, oh my gosh, with the chlorhexidine, I failed. With the chlorhexidine wipe, I would go back and forth for 30 seconds. And after that, I would let it fully dry. And then I would place this little disc under there. and then the Tegaderm over the top. And then I am going to scrub with the alcohol pads, 30 seconds per each hub. And I am going to be flushing with either saline or heparin, depending upon hospital policy. But before that, I am going to look for venous blood return. And before I put that on, I would have let it dry for I would have let it dry fully. So then I would flush and place the sterile cap on it. And then I would do the exact same thing on this side, scrubbing for 30 seconds, letting it fully dry, looking for the blood return, and then flushing. At that time, I would also be asking the patient if they were in any pain when I did that, or, and then I would also be pulsating the flush. And I would place a cap on both, and at the very end, I am going to initial, date, and time that I did it, and take, oh my gosh, take that off. I don't know where my date and time went. There we go. And I would wash my hands. And I'm going to put the bed back in the lowest position, ensuring the call light is within reach and the side rails are up. The bed is locked, and I'm going to dispose of all of my dressing change equipment and ask the patient if there's anything else that they need, and thank them for their time. And then I'm gonna go document. Thank you.